Have you ever experienced persistent bone pain, unexplained swelling, or noticed an unusual lump that made you wonder what might be going on inside your body? It is natural to feel concerned when these symptoms appear, prompting many to seek medical advice for clarity. Understanding how doctors get to the bottom of such concerns can be incredibly reassuring and empowering. When a doctor suspects primary bone cancer, the diagnostic process involves a series of careful and thorough steps designed to accurately identify the condition. It typically begins with your doctor gathering detailed information about your symptoms and medical history, followed by a physical examination, and then moving into specialized imaging tests and ultimately, a biopsy. This systematic approach ensures precision in diagnosis. The reason for such a detailed diagnostic journey is that symptoms of primary bone cancer can often mimic those of other, less serious conditions like sports injuries, infections, or benign bone tumors. Doctors need to definitively rule out these possibilities and confirm the presence of cancer, determine its specific type, and assess how far it may have spread. This meticulous investigation is crucial because the treatment approach will vary significantly depending on these precise details. It is about understanding the exact nature of the problem to provide the best possible care. The diagnostic process typically unfolds in several stages. First, your doctor will take a comprehensive medical history and perform a physical examination, focusing on the affected area. Next, imaging tests are essential. These often start with an X-ray of the bone in question, which can reveal unusual growths or changes in bone structure. If an X-ray raises concerns, further imaging might include a magnetic resonance imaging, or MRI, scan to get detailed pictures of soft tissues and bone marrow, and a computerized tomography or CT, scan to show precise bone detail. A bone scan might also be used to check for abnormal bone activity throughout the body, and sometimes a positron emission tomography, or PET, scan can help detect cancer cells. The most definitive step, however, is a biopsy. This involves carefully removing a small sample of the suspicious tissue, either with a needle or through a small surgical incision. This tissue is then sent to a pathologist for microscopic examination. This pathologist is an expert who can confirm whether the cells are cancerous, and if so, determine the exact type of primary bone cancer, such as osteosarcoma, Ewing sarcoma, or chondrosarcoma. This detailed cellular analysis is critical because each type behaves differently and requires specific treatment protocols. Furthermore, once a diagnosis is confirmed, doctors will perform additional tests to stage the cancer. Staging helps determine the size of the tumor and whether it has spread to other parts of the body, which is vital for planning effective treatment. Often, a multidisciplinary team of specialists, including oncologists, orthopedic surgeons, and radiation therapists, will review all these findings together. Navigating a potential bone cancer diagnosis can feel overwhelming, but understanding the structured diagnostic pathway can bring clarity. Each step, from the initial doctor's visit to the advanced imaging and the definitive biopsy, plays a vital role in building a complete picture. This comprehensive and precise approach is the foundation upon which doctors develop a personalized and effective treatment plan, ultimately guiding you towards the best possible outcome.